Dr Javaid, I'm a rheumatologist from Oxford. I'm really grateful for inviting me to present a really exciting project we're doing across the UK looking at rare bone diseases. So the first question is, why do we need Rudy? And I think the questions from the audience and the talks this morning really highlight this. The rare diseases are under-researched, and the information for patients and both the specialists and the general doctor is very fragmented. Most of the treatments and tests we use are really based on osteoporosis and diseases that have got nothing to do with osteogenesis in terms of their mechanism. And where we do have evidence, it's really limited to childhood, and the evidence for adults is very sparse. So if you look at NHS choices and put osteoporosis in, you've got a wealth of information. There's even videos about the diagnosis, the treatment, and the options you have for management. Put OI in, and it's referenced in joint hypermobility. And if you search for other rare diseases, such as fibrous dysplasia, there's nothing. So there really isn't an NHS-based information source for patients with osteogenesis imperfecta or other rare bone diseases. The government recognised this and really was informed by one of the Rudy patient forums who said, well, when I see my doctor, they never have the whole history. If I change hospitals, it's a nightmare. They never really know what happened in the other hospital. If they don't have the right information, how can they choose the right treatments? And if they don't know what's happened to me in the past, how can I get the right decisions? And really a successful solution is to have a comprehensive record of what's happened to me. Doesn't matter which hospital, doesn't matter which consultant. And the other comment is at the bottom, which I think is still true. So Dame Sally Davis, who heads up a big research organisation within the UK called the NIHR, set up the Rare Diseases Translational Consortium. And the aim is to improve the health and wealth of the nation, and it recognises the NHS, because it has a single provider, most people get their healthcare through the NHS, is a fantastic resource for us to understand diseases better. So there was a bidding process, and Oxford was chosen to be the hub for the musculoskeletal, so rare diseases that affect the muscle and the skeleton, which OI sits within. The musculoskeletal is one of 14 other disease themes. It includes cancer, rare heart disorders, rare disorders of the lung, rare disorders of the skin. So we're all grouping together to try and improve care for rare diseases. And it's got four real main aims. Number one, support patient-centered research. That's really important. We want to improve outcomes for patients. The way we're going to do this is to actually study people with a rare disease diagnosis and see if there's interesting subgroups, patients with features that other patients don't have, and then use state-of-the-art biology to try and understand why these occur. If we can understand the mechanisms, we can work with drug companies to make disease-specific tests and treatments rather than borrowing treatments from other common diseases. And also to build up the next generation of clinicians. So in 20 years' time, there's another me sitting here doing this presentation. Because at the moment, academic research in rare diseases, especially the bone, is getting smaller and smaller. So how are we going to do this? First of all, we didn't have anything to work on. Each hospital has got their own collection of patients, but there's no national group. So we wanted to recruit patients across the UK, have them all complete an assessment tool, have some blood tests, maybe some other tests as well, so we get a complete record of their disorder and also the tests and treatments they've had. From this, identify people with different subgroups of disease, and we now have very good genetic and non-genetic tests to understand the mechanisms, and then work with industry to really develop new tests and new treatments so we can then bring back into the NHS to improve outcomes. So in the middle, I've summarised that, and the real aim is to reduce the impact and improve independence of patients with rare diseases. Obviously, this will increase awareness of diseases. We'll get information about how the disease will progress, so we can tell patients when they're diagnosed early in the history of disease, by studying other patients, these are the likely outcomes. At the bottom, we're going to train the next generation of clinical leaders, but importantly, when a drug company comes with a new drug to test, the UK is seen as a great site because all the patients have already been seen and tested, and we know which subgroups will be eligible for which trial. So the way we did this was to set up a database where we have a patient environment at the bottom, a clinical environment for the doctors, and then a research environment. And I'll go through these in more detail. We had to recruit patients and participants across the UK, irrespective of which hospital they go to. Most adult patients aren't under regular follow-up and are just left with their local DGH and don't have the specialist care that the children have. And the system is that the patients go to the rudystudy.org website, they register, we then arrange a telephone consent, they agree to take part, they get full access to their website, where they fill in a detailed assessment tool, and we arrange any blood tests or scans as needed. Patients are key to this. We have a patient forum, and there are members in the audience who help us every 2 months. We have a multi-site Skype, where we go through how we're progressing with the study, are there any concerns, are there any areas we should focus on. Also, any new features to the database we produce, we send to all the patients on the forum to test to make sure they work and are understandable. The patients are then represented on a series of committees. The first committee is the Data Oversight Committee. This just basically checks the database and the data coming in is accurate and precise and meets all the ethical standards. We're very careful to make sure all the sensitive and patient identifiable data is kept as confidential as possible. The second committee is very simple aim. Whatever we collect, we want to make sure it benefits everybody as much as possible. So anyone can apply to use the data for research. And this is very important. Too often, we spend so much time collecting data, we can't actually use it to its maximum ability. And that's the Data Access Committee. So how have we progressed so far? Well, we've recruited a lot of sites across the UK, and you may recognise sites that you belong to. And these are the partnership sites that were involved in setting up the Rudy project. And if your hospital isn't on there and the consultant's interested, let me know. I'll write to them and ask them to join the Rudy network. We really are an open network for research. We had our first kick-off meeting in March this year. We had 6 talks, 2 workshops, 7 charities and 7 PPI members. And we had researchers from across the UK with these charities represented. It was a fantastic day. Within 6 months, we were able to put the whole study together and get it through ethics and approved, which is impressive compared to most other studies. So we now have full ethical approval to proceed. We've set up the database, and this is freely accessible by anyone who can use the website. So you go to rudystudy.org, and it's got all the information you need. So I'm just going to walk you through that. If you click on the library page, it's got all the study information you need. Information for adults and also for children. And really you can read through these, and we're going to make this a lot more dynamic as we get more complicated with the studies we're including. If you're interested after reading this, you then click on the Sign Up Today button. Here there are 3 pages. You can either sign in as a participant, or if you're under 18, get your parent or guardian to sign in, and then you fill in details of the patient, whether it's you or your child, how did you hear about Rudy, then an email and password. And that creates your registration account. You then fill in what disease you have. If you're not sure, just put it in under other diagnosis. You may have osteogenesis imperfecta, unknown type, or just bone fragility. You can put it under other diagnoses. And then give us a few phone numbers and tell us when you want to be contacted so we can verbally consent you. You then complete that process, and we encourage you then just to look through the patient information sheet in case there are any questions you may have. The team in Oxford will then call you at one of those time slots, give you any information you want, to answer any questions, and offer you verbal consent. You can then decide whether or not to consent, and if you do agree to consent, we'll email or post you the consent form you need to fill in, given your age and diagnosis, which you have to carefully fill in and return back to us, either by scanning it back to us by email or posting it back to us. You'll then have full secure access to your web page on Rudy. So what does that mean? First of all, when you log in, you'll have a separate login when you sign in the top right, and you complete the secondary registration page, which basically collects some information about you. Some of the information is which town were you born in, what's your middle name. We have no interest in that from a research perspective, but this information is used to make an ID number that can be used across the whole world, because we're looking to link this up to other global IDs. So some of the questions are asking, why are they asking this? It's because we need to create this global ID that takes into account the town you're born in if you've got a middle name. We'll ask to record the hospitals and consultants you see, because we'll write to them to confirm the diagnosis. And then we'll also ask for information about your GP. Then once you've got through that, you'll enter your main page, which has got a to-do list with questionnaires, and then a profile page. And we have built these questionnaires so they're as easy to complete as possible. They're set up so a lot of them are point and click. They work off any device, whether it's a tablet, a mobile smartphone, or even your laptop or computer at home. So for example, we're very interested in pain in patients with rare bone diseases. It's often difficult to assess, can affect different parts of the body, and has different mechanisms. So we've got a pain detect questionnaire, which is the current standard we use. Unfortunately, there isn't a questionnaire for rare bone disease patients. So in the beginning, there are lots of questionnaires you're going to see. You're going to think, I've already answered this in another questionnaire. And we have to do that to then decide which questionnaire is most applicable to which rare bone disease. And as this is the first phase, there are going to be a lot of questionnaires that you'll be filling in similar questions to, but it's really important we do that so then we can say questionnaire A is much better for OI, whereas questionnaire B may be better for another rare bone disease. Because at the moment that information just isn't known. So this is another questionnaire which is called the EQ5D, and this is really important when the government decides how much value or how much benefit a drug treatment has. So this gives them the ability to compare treatments for cancer with treatments for rare bone disease and measures quality of life. We've made it very easy for you to complete the whole questionnaires on one page, and at the end of it you can get a sort of summary of the impact of your disease for different states, from ability to self-care, anxiety, depression, usual activities of daily living, and mobility. And we'll ask you to fill in these questions every 6 months, and from that, for the first time, we'll have an understanding of how rare diseases are affecting patients on a longitudinal level, rather than just once when they entered into the study. I mentioned blood test, and this just shows you how, within the study, the information and the data is collected. On the top are the questionnaires, which we will prompt you to complete every 6 months. Take as long as you want, but we do want you to start completing them every 6 months. And at the bottom are the tests. At baseline, we'll ask you to go to your local research facility to have blood and urine tests. And then when we've got enough blood and urine tests at that site, we'll then ship them all to Oxford so we can make sure they're all secure and logged and registered on your website. And on the website will also be a list of hospitals that if you are visiting, we would like to visit for your blood test. They don't have to be exactly at baseline, they can be within a few months. So if you've got an appointment coming up and you say going to Manchester, we'll ask you to have blood tests while you're there at your appointment. Rudy, as I said, is patient-driven research. The patient forum is about 12 patients, and we're looking to get more patients on board. One aspect of that is to use something called dynamic consent. So with Rudy, we're looking for lifetime involvement in the cohort. How many people here have been involved in a research study? Right. Usually what happens is at the beginning, you read a load of information, you sign loads of forms, and then that's it. And then if you don't turn up or you don't have the blood test, they'll either say you're not part of the study or keep you involved. We're changing that. We're asking you to say, actually, right now my life is really busy, I haven't got time to fill in the questionnaires, or I haven't got time to do the blood tests. I really don't want you accessing my information for research anymore. I'm going through a rough time. All you do on your website is just change your permissions. So you'll be able to change, for example, whether you want a bone density scan or not. And say, actually, right at the moment, I can't fit this in, and change it to a cross, which will mean we will no longer require that from you from the study, but we'll still be able to use your other information. If you change your mind, that's fine, we'll just reinstate you into the normal protocol. But that way, it's a way for you to communicate to us how your life is and how able you are to complete the study. Clearly, this is very sensitive data, and we take data protection very seriously. all of your data, once it's put in, is immediately encrypted, and actually only 3 people can actually see who you are and where you live, just so they can tally the records they get in with who you are on the database. Most of the other data will be kept in a separate place that's non-identifiable. You put all this effort in to put the information into Rudy. Patients wanted to have it back. So there will be a function called My Copy, where you'll be able to produce a date-stamped PDF of your entire record you've put in. All your questionnaire responses, all your fracture, everything you've put into Rudy, you can then get out as a PDF. We've made it time-stamped and dated so no one can change it. It's your record. And in the future, you may go into your hospital and they say, we haven't got your records. You can say, actually, it's all on Rudy, and they can log in and look at it. But the only person who can log in will be you. On that same sort of flavour, we're going to recruit your consent status, as I've already said, but also your contribution to research. Any questionnaires you've put in, any samples you've given us, any tissue you've given us, if you had a biopsy, will be put on the website, on your webpage, and you'll see exactly what your data is being used for, which studies it's gone into, and if there's a paper that's been published, there'll be a summary that's easily understandable by everyone, so you can actually see the impact that your data has had on research. We'll also feed back to you on disease-specific and new drugs coming out, new trials coming out, and how Rudy's doing in general. The one project we have funded is in Sheffield, where they're looking at people with atypical OI doing skin biopsies to see if taking a skin biopsy can improve our understanding of the mechanism of OI in patients who don't fit the normal pattern of OI during childhood. So the next stages we have for Rudy are we're going to put in a substantial amendment end of this month to include adults who don't have capacity to give consent. We're putting a very simple physical function assessment for both children and adults, and 3 more new questionnaires, one looking at health economics, one looking at tiredness and fatigue, and one looking at mood in more detail. So the next step is we've now recruited about 30 patients into Rudy, and we've tested the consent process. We're now going to start opening it up to other charities. The first charity we're opening up to are patients and participants with the Brittle Bone Society. We only have limited resource to recruit everybody, so we don't want everyone signing up at once. We're going by charity to recruit people across the UK. Once we've gone through all the charities, we'll then approach all the major hospitals that the patients left, and then in 9 months' time we'll run a public advertisement campaign to advertise to patients who aren't within a charity or hospital to capture them as well. And hopefully through the stepwise recruitment we can manage the consent process. We've got 4 new projects under review. We've got a doctor who wants to do a PhD in rare bone diseases and a junior doctor working with us as well. And we're working with industry and other charities to make sure we get the highest quality research from the data going in. Very complicated slide, I just want to tell you how much we've done. So at the top left, we've completed the website and homepage, even with an out of service. So if you guys manage to break the database, we'll put on the website, it's under repair. So you'll know that it's not just you, it's something on the database. We've got an information library which we've completed for all the patient forms and researchers, and now we're just working on the industry, and also we're going to make podcasts and videos which your children or you yourself can see to show you how to complete the questionnaires and answer frequent questions. We've completed the registration, consent and secondary registration process. We're looking to tie up some elements for the research process. We've completed the first stage of questionnaires, they're now on the database. We're now working on the disease page and the timelines. And these are all the other facets that we're now working on. Disease impact, medications, procedures and visits. The timeline is something we're really excited about. And we've taken Facebook models to develop this. And this is a way for you to record both what's happened in the past and what's happening in the future. And this is a feature that will be coming online in the next few months. So basically you'll be given a skeleton and you'll be given a date or a date range in which you can enter how many fractures you've had. So if you've had 100 fractures, you can just put a date range, you can just click as many times as you can remember for whichever bone. So the left humerus, how many times you've broken that, and the pelvis, how many times you've broken that. If you know the medical name for the bone, that's great. If it's just the forearm, you can just put the forearm. If you're not sure, put a rough estimate in. But it's just a way of collecting data of what's happened in the past, and we're hoping patients will then put in the data as they fracture as time goes on. What we're very interested in is the healthcare costs. We have to go to the government and say, OI is really expensive, this drug is really expensive, but it's still cheaper to treat than not to treat. So we're going to ask for information about when you fractured, did you have to go to hospital, or were you treated at home, or how many operations did you have, what medicines did you have, and how well did you recover and what complications. We're also developing disease-specific templates. Do you have blue eyes? Do you have hearing problems? Do you have heart problems? Maybe specific to OI, as well as the other rare diseases you can see there. Impact's really important. We're going to give the opportunity for patients and participants to write down, how does OI affect you? Can you give us the top 3 impacts? We don't know. We're going to look at the effects on school, training and occupation of having OI. How does it affect your ability to work or not to work, your training and your education? And then the use of mobility aids and benefits, and trying to get a full economic picture of OI. Key to this sustainability, we put a lot of effort in over the last 9 months to build Rudy up from where it started, and we have to go for renewal of funding, and this is where you can really help us. We're funded through the NIHR, and they have lots of different ways to renew the funding. We've now been accepted by the University of Oxford as a special theme, so there will be some funding from the University of Oxford to keep Rudy going. How can you help us? Join the patient forum, have an active part in how the website and database is structured. The patient forums are Skypes every 2 weeks. The last Skype was a disaster because my computer overheated. We're looking at better ways to run it, but it's every 2 weeks. And what we'll do, Alison Turner, who's administrators, will email you out that this is a new questionnaire. We'll give you a special login so you can go to the test sites of Rudy, and you can say, try and break it. Which question? Try and use it on different computers, PCs, Macs, phones, Androids, whatever. See if you can break it, and let us know how you feel about it. Obviously, we need patients to be represented on the doctor groups, because actually this is all for patient research. If there's no patient voice there, they're less effective. We need your ideas. When I did the voice talk, we had 3 great ideas, which have now gone in to what we call a portfolio of research ideas that researchers can look into. Things that medics don't think about, and spread the word. The reason is we have to show value. Even though they've been running for 9 months, the government still wants to see how much value have we added, how much has the investment changed. And one thing they look at is the number of people recruited and the number of completing assessments. And importantly, publishing what we find. How much impact have we had through Rudy in improving the evidence base and patient care, both on impact on patient lives, patterns of fractures, and problems with bone pain. So just for the Brittle Bone Society, the first charity, we go live on the 15th of September. We've lined up a team of researchers, and they're all ready to give you consent on the 15th of September. So if I've got cards here, you can pick up a card now. It's really easy. Just go to the rudystudy.org website. It's all there. There's no more information you need. It's all on the website, and you can start on the 15th of September. Put in the dates you want to, read the information sheet. If you want to take part, take part. I'm just a small cog, so these are the people you might meet. David Gray, sitting on my left, he's a database manager who manages all the data. Joe Barrett is the head programmer who's made the database as it is, and it really is, once you get into it, you'll just see how easy it is to use. Alison Turner is the main administrator, and she'll be the person you'll talk to most. If there's problems or queries, you'll go to her. Rory Poppett is the project manager, and Harriet is the ethicist who makes sure everything we're doing is patient-focused and patient-delivered. As I said, this is a huge project. As well as the team in Oxford and Patricia, there are other charities involved, and we've now just got our Captonuria charity and Find a Cure involved. And these are all the centres, and I really want to thank our collaborators so far and the Patient Forum for all the hard work. Without them, we've never got this far. So on that note, I'd like to finish. Lots of information. There are questions. I mean, you can go on, if you've got a smartphone, you can go to rudystudy.org now and just check it out and see if you can see what you think about it. But thank you very much.